Hello there. Hope you're doing well. I just wanted to create a little video on how to self-treat if you have a headache. Now, there's lots of things that can cause you to have a headache. One thing in particular is head and neck posture and repetitive movements. Perhaps there's a lot of other things going on that are contributing to that headache sensation, but here's a way that you can engage with the muscles to help release tension and turn down the dial on an active trigger point. So you can see here in the diagram, the red area is usually where you might experience pain. So you've got across your forehead, headache, feels like pressure, perhaps like a vice grip around your forehead and around your ear. Can feel like it's in your ear or around the ear. And then, of course, your eye, around the top of eye and just vaguely around the cheek and eyelid area, even the chin, and also the lateral neck and around the collarbone. Now, this is directly related to the muscle known as sternocleidomastoid, or SCM. And you can see in this picture where the muscle originates on the collarbone or clavicle. It's quite a superficial muscle, and it moves up and connects a little closer together, and it inserts up here at the mastoid process on the temporal bone. And the X's here kind of indicate trigger points within the muscle. Now, this particular muscle, you have two on both sides, one on each side, helps you flex forward at the neck, helps to rotate. Now, when you rotate, it's the opposite side actually contracting. I'm rotating left, my right side is contracting. And then it helps you laterally flex, so side bend, and it's the same side that contracts as I side bend. So flexion, rotation, and lateral flexion. And this muscle is the one that you'll get a lot of activity in if you happen to experience whiplash. If you experience whiplash, there are lots of other muscles that will contract as well, but this one will be very active. It's like when your head gets thrown back and then forward very, very, very fast. You may experience a buildup of tension in these muscles if you look down at your phone a lot, and that's what we are all doing. If you're at the computer for a long period of time and you start to slump and you get this forward head posture, there's a lot of pressure up here, and that also contributes to pain in the jaw. So with that information, we're going to palpate our SCM using like a pincer, pinching type grip. So I want you to grab, if you've got a mirror, that's probably the best place to engage with it, to visually see the origin and then the insertion up here. And you can just gently pinch and feel the thickness of the muscle, pulling it slightly away and kind of rolling it through your fingers. And then if you find a spot that feels particularly sensitive, I'm going to suggest you gently hold it and notice where the referral pattern is. For me, I feel this around my ear and a little bit around my jaw here. So with a comfortable pinching type grip, just hold it. And then also notice how you're breathing. If the pain is too strong, your breath will increase in terms of it will become shallow and rapid. So we want to use the breath as a bit of a guide to help the trigger point deactivate. And just actively practicing vagal breathing. So that's like a slower exhale. And if you need to add any sound, like a sigh or a hum to help down regulate the pain response, you can. And then when you feel ready, just finding another spot as well. Doing the same, a couple of breaths in these positions. And then try the other side. And again, just feeling out the muscle itself, moving up from the origin to the insertion and just noticing if it feels different to the other side. This side for me is a little tighter up the top. And it does still refer to my ear, but it also comes into the back of my head a little bit and a little bit at the top. Just noticing where, with your own pressure in this pinching type grip, feels like your referral is, and seeing if you can hold it and using the breath to help regulate it. Good. And then from there, coming back to the other side, this time we're going to gently forward bend the head and see what that feels like. So we're taking the muscle through its range of motion, contraction. You can do that on both sides. And you might just move around with your grip. And then we're going to side bend to the same side, which feels a little bit awkward, and it might actually induce the sensations a little stronger. And then for this third movement, we're going into rotation, but we're moving away and then towards. Remembering the muscle contracts when we move away from that side and then relaxes as you come towards it. You're just gently playing around with where you pinch the muscle, the trigger point area, and moving nice and slowly, doing that on both sides. And then you might just gently rub down. Now, if you want to use any kind of oil like coconut oil, if you have massage cream or moisturizer, you can always do that on both sides. And then we're also going to come to the jaw area here. So digging your thumbs into the very back of the jaw here. And then on top, you'll feel like this very tight region. Most people clench down and these muscles get very, very active. And we want to just, in circular motions, just massage with a pressure that feels good for you. Like there's no need to go really, really hard and poke in there to really exacerbate symptoms. It's more about offering some tenderness with your own touch and increasing blood flow to move things out that might be stuck, some toxins. And then again, just breathing and seeing if you can really let your jaw relax as you breathe. And after the circles are coming from you can feel where your top teeth are at the back there. And then just coming down and with a little open jaw, just noticing what that feels like. It can feel a bit icky. Might even feel like tingly. If you feel nauseous, just back it off a little bit. Working towards the back of the jaw where it can be very sensitive. but also we'll feel a lot of relief once we've given this a little go. And you might even come underneath with one finger on either side, working towards the front of the chin and back. And again, just playing around with your own pressure. How often do you, other than maybe cleaning your face and doing all your beauty stuff, skincare, makeup, all that, how often do we actually touch the face and get in touch with it? It holds so much tension. And just gently pulling. There's a sense of push and pulling back to open up and stretch, giving yourself a facelift. You can do that around the temples as well and really pull back onto the scalp. Oof, feels good. To the forehead. And if you want to go into your scalp, you can. You might even find a position and kind of like you're shaking your hair and scalp, like you're loosening that vice grip. And work your way around to the base of the skull, the back of the head. Feels nice. It's like you get a head massage when you go to the hairdresser, but it's so good to have a head massage. And then we're just going to tap. It just stimulates a little bit of over here in the present moment, just lightly tapping. Just kind of notice what that feels like as you're playing around with that. And one of the most important things besides actually releasing things is like having released, we need to find efficient posture. So if you tend to find yourself here or here looking down, what we need to do is engage our neck extensors more, so the back of the neck. So you can do this lying down, standing against a wall, like with your head and upper back kind of flush against it. You might put a towel at the back of your head at the wall, in the car against the headrest. And we're going to retract the head back. So retraction is not flexion. Retraction is where we take the head back in space. So we're engaging around the deep neck extensors and flexors, trying to lengthen the front, contract in the back. All right, look like you got a double chin, which is totally fine. This is about function, not about beauty. And it feels quite nice when you do it. Like I feel my thoracic spine, like my mid to upper thoracic spinal extensors engaging as well, which is quite nice, especially sitting at the computer. If we tend to be like this, we want to get more extension, lengthening through the body. And that way our weight is distributed more evenly and we can work up into gravity a bit better. We're not being pulled down like this, getting shorter. And that also helps with breathing. So being able to take a deeper breath means we're not using our accessory muscles, which is the muscles we've just worked on. They help to move the bones, but we tend to breathe a lot through these muscles or with these muscles when we fill up our lungs. So play around with that and get the spiky ball into the where this SEM inserts, lying on the floor, put the ball at the back of the head and just turning the head into the ball can help. Even laying on the roller, opening up the chest, turn the head to the side off the roller and stretch it out through the neck. Heat pack on the back of the neck and shoulders. Let me know how you go. See ya.